In America, 1 in 1,000 black men and boys will be killed by police. Compare that with the fact that 1 in about 2,000 black Americans have died from COVID-19. We're living in a moment that truly feels different than any other in my lifetime, and it feels like we have the opportunity to finally confront systemic racism. The murder of George Floyd has sparked weeks of nationwide protests against the system that took his life. In this video, I'm going to make the case that his death and the healthcare disparities that black and brown communities face come from the same institutional and structural problems. Healthcare disparities have existed for centuries, but we've never seen them play out in such a dramatic and immediate way as during the COVID-19 pandemic. George Floyd was killed in the state of Minnesota, where black Americans make up just 6 out of 100 people, but account for 1 out of every 3 COVID-19 deaths. By making this video, I want to show how these disparities affect black and brown communities, but I also want to show how the amounts of illness and lost lives are a result of how the system and our society is set up. We'll be talking about the following topics: what our healthcare system is good at and where it's lacking, how social forces become barriers to healthcare. We'll talk about the one number that's more accurate than almost any other in predicting how long you'll live and what quality of life you'll have. And we'll talk about how all of this leads back to today, with black Americans being disproportionately affected by COVID-19. Before we start, I want to say thank you to Dr. Clyde Yancy, Chief of Cardiology at Northwestern University. He recently gave a lecture on this topic that inspired me to make this video. What I've come to realize is that American healthcare is really good at taking care of people at the point when they have to come to the hospital. You're having a heart attack? No problem. We have all kinds of new devices and drugs that will save your life. Your kidney stopped working? Easy. We'll put you on dialysis. And that's a good thing. Life expectancy has increased drastically over the past 100 years, mostly because what we know about the biological mechanisms of disease and the treatments we've designed have gotten so much better. At the same time, the kind of medical conditions that are affecting Americans are diseases of modern lifestyle, meaning they're a direct reflection of the way we're living. On average, we eat more, move less, and are more stressed than ever before. Diseases of modern lifestyle are called chronic medical conditions. Some examples are obesity, diabetes, and high blood pressure. When left untreated, chronic medical conditions turn into emergencies. Diabetes and high blood pressure are the biggest risk factors for kidney failure, heart attacks, and strokes. So if we know that, then why does our healthcare system do such a bad job with prevention? My years in medical training have taught me how to save lives, but what medical school doesn't teach is how social forces beyond the control of my patients affect them way before they come to the hospital. These forces are explained by the concept of social determinants of health, which is defined by the World Health Organization as the circumstances in which people are born, grow, live, work, and age, and the systems put in place to deal with illness. What this concept means is that health and illness don't happen randomly and equally to people, but are instead the result of social, economic, and environmental forces. How strong are these forces and how much do they affect health? To answer that, let's examine some of the different barriers to getting care, which are lack of health insurance, lack of convenient medical services in your geographic area, and possibly discrimination. In contrast to all other industrialized nations, in America you have to consider whether people can afford medical care. Your ability to pay for healthcare services is affected by your income, economic stability, and insurance status. And with nearly 1 in 5 Americans out of work during the pandemic, and with health insurance being closely tied to employment, this becomes more relevant than ever. Not having insurance has been shown to significantly increase mortality, with up to a 1.5 times higher risk of dying. Another barrier to consider is whether you can actually get medical services, meaning is medical care available and convenient to you? During the COVID-19 pandemic, we've been seeing a lot of patients over the phone or over video chat, which depends on you having good service and internet access. If you're able to get medical services, what's the quality of care you'll receive, and could it be affected by your race? Racial and ethnic minorities have disproportionately worse health outcomes and life expectancy. For example, the American Heart Association reports that Black Americans are 2 to 3 times more likely to die of heart disease compared with whites. How do you explain these disparities? I don't think you're going to find too many healthcare providers who are overtly racist and are refusing to treat Black or brown patients. But there's a difference between overt racism and institutional and structural racism. Implicit biases held by providers may influence medical treatment and may result in lower quality clinical interactions. For example, a study using scripted, videotaped interviews of actors portraying patients with chest pain found that physicians were less likely to recommend the correct diagnostic study for Black women than for white men reporting the same symptoms. All of these barriers and more are neatly summarized by one simple number, and that number predicts how long you'll live. What is that number? It's not your cholesterol level or your blood pressure, it's your zip code. Where you live determines how long you'll live. A drastic example of this is in Washington, D.C. If you were born in the Friendship Heights neighborhood, your life expectancy is 96 years. Less than 10 miles away in the Berry Farms neighborhood, the life expectancy is 63 years. That's a difference of 33 years, or the span of one human generation. Neighborhoods with large Black populations tend to have lower life expectancies than those that are predominantly white, Asian, or Latin. Race and ethnicity have little biological or genetic basis, and the lower life expectancies are not inherent to being Black. Rather, they're a reflection of access to educational and economic opportunities, grocery stores, open areas for recreation and exercise, and medical care. So in today's world, you don't have to be racist to affect Black and brown communities because it's built into our economics, policy, and public behavior. Social disadvantage and systemic disinvestment in communities of color is a choice we've made, and the cost is lost years and lost lives. These social forces are not new, and they've been centuries in the making, but they've come to a head in a truly unfortunate way during COVID-19. Black people make up about 55 deaths for every 100,000 people, which is more than double that of whites, Asians, or Latinos respectively. Put another way, if Blacks, Latinos, and Asians died of the same rate of COVID-19 as whites, then 13,000 Black Americans, 1,300 Latino Americans, and 300 Asian Americans would still be alive today. We have to do better for marginalized communities because their health is our health. And to do that, we have to fundamentally change the way we think about healthcare and society. For updates on where we're at with COVID-19, you can click the playlist here. I go over things like how safe is it to exercise outside and what's the role of antibody testing. Thanks for watching. I hope you're staying safe, and I hope to see you soon.